Ensuring your ward surfaces are clean and germ-free is extremely important, as these surfaces are often touched by many different staff, patients and visitors. The key to cleaning these patient-touchable surfaces to higher levels of cleanliness is to focus on removing dirt and germs instead of simply moving them around the room. To do this properly, it is important for us to use a microfiber cloth that is capable of not only loosening dirt and germs from a surface, but is also capable of removing them by picking them up and holding them within the fibres. The Interclean microfiber cloth has been designed with this in mind. Each Interclean microfiber cloth is capable of picking up 150 ml of solution. However, when we prepare our cloths for use, we only add 80 ml of solution to each cloth. This means the cloth is always in a state of absorption, allowing you to clean and remove germs and debris with each swipe across the surface. If your cloth is over wet and has reached its capacity to absorb, then it will not be able to pick up and hold the solution you are cleaning with. Start your day by knowing how many separate areas you are required to clean. In most cases, a cleaner will be cleaning approximately 12 ward areas, requiring 12 blue cloths in a ready-to-use state. Place these 12 cloths into a bucket on your trolley and add 80 ml of solution per cloth. All cloth preparation should be performed in the cleaner's room at the start of your shift. Also, make sure you set up any other areas, like washrooms or public areas you may be required to clean. To minimise cross-contamination, on arrival at each new area to clean, previously used gloves should be removed. Your hands should be washed properly, dried, and a new pair of gloves put on. Take your clean, pre-moistened, ready-to-use cloth and fold it neatly twice to give you 8 cleaning sides to use. Start by wiping the surfaces closest to the patient and work away from the bed area. Wipe the overbed table with the first side of the cloth before turning it over and wiping the bed controls and call buttons. After unfolding the cloth to the next side, wipe the bed rails and any other patient-touchable surfaces within reach. Unfolding to the next side, wipe the other furniture near the bed. Turning the cloth inside out to the next side, wipe any window ledges and visible marks on walls. Continue unfolding the cloth to the next sides and wipe any basin, taps and mirrors in the room. Once you have finished using all 8 sides of the cloth, place it into the bag on your trolley for later laundering. Because this cloth has been used in this room and is now full of germs and dirt, it should not be used in the next area. Interclean microfiber cloths can be laundered up to 700 times at temperatures up to 95 degrees and are available in 5 different colours, including bleach-resistant white. For a better finish on daily cleaning of reachable glass surfaces, use the handheld holder with the micro glass cloth. Simply spray your glass cleaner or pure water onto the surface and wipe off with the micro glass pad. Pads can be laundered with your other microfiber.